Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this finds you well. I'm sitting here with Alex. Alex is a nurse practitioner in our practice. Been with us for
about a year now, I would say.
About a year, and did a year, correct, of training with us?
Probably about 6 months.
About 6 months of training with us.
Lauren,
with Lauren,
yourself.
Yep. And so Alex, what I thought I would do is introduce her to you because she does wonderful things in the practice here. I highly endorse her. But also, what is a nurse practitioner and what is the role of a nurse practitioner? Well, let me first say this, and I don't want to say anything, so you correct me.
Sure.
But I learned even here when I started interviewing and incorporating nurse practitioners into practice, really, truly what a nurse practitioner was, which is the base of it is a nurse, obviously, and gone to school besides undergrad, et cetera, in nursing school, but also then further education in nurse practitioner school, but also you had to maintain practice at hours in the hospital, correct?
Absolutely. Yeah. And there are different levels of registered nurses. So in order to become a nurse practitioner, you have to be the highest level of prepared registered nurse. So there's 3 different tiers, and you definitely have to have your 4 to 5 year bachelor's degree to even start the process of being a nurse practitioner, as well as 2 years of my personal experience was ICU, so 2 years of acute care practice before you can even begin to get your master's or graduate degree as a nurse practitioner.
Yeah, so it's the thing that was very impressive to me, and to be honest with you, I was kind of in the dark about it a bit. I knew that they were highly qualified, but I'm like, wow, you've done a lot in the hospital, and my background being a ER family practice doctor and obviously residency and all that, you spend a lot of time in the hospital, and the one thing that you can't really negate or kind of get around, and it's the experience in a hospital in an acute and somewhat recurrent acute care setting where you're dealing with a lot of illness, a lot of diseases, and I think that gives us a little bit of a different perspective sometimes in making sure that we, consider everything. So even though we're practicing more of a functional, personalized medical approach here and bringing you the best to make your quality of life the best and resolve conditions and diseases, we still have to be real medically and make sure that we're not missing or overlooking, or if there is a chronic management disease that you have or potentially could have, we have to be very thorough there. And so nurse practitioners are amazing, in my opinion.
Thank you.
And yes, you see them out there, and I think they don't get enough kudos and credit because it's a little bit, correct, an up-and-coming field and growing.
And it's been around for a very long time. Actually, if you go back to the history of advanced practice nurses, I found this kind of funny, or kind of like a fun fact, but the first anesthesiologists were actually nurses in the Civil War, Revolutionary War. They were the ones administering all of the ether, if you go back in history, but then it became more of a physician-dominated profession. Okay. But it's got a pretty long history. Okay. But yeah, it's not a lot of people know what a nurse practitioner is, and like you said, the title of nurse practitioner is pretty new in the last 40, 50 years. Right. And there wasn't as many of them. And also, Michigan is not necessarily a full practice state like other states. So if you go to another state, you have nurse practitioners that own their own practices. So it's a little bit different here.
But to say this, though, you, and I would endorse this and say this, we have 2 very high qualified nurse practitioners, and I fully endorse them where when you say have their own business and run their own practice, you're so good, and we have so much trust in Alex and in Lauren, our other nurse practitioner, that they run their own show. Now, literally, they have total autonomy. That's how much trust I have in them. But also, we're, of course, always discussing cases and bouncing things off each other and all that. But I find it really, really important for my patients out there, or potential patients out there, to understand this because a nurse practitioner participates in your care is of no lesser value than actually seeing me. And I can truly say that. They're trained under me. They're following a functional, personalized medical approach, and even as recent as...
And he's the best teacher, too.
But even the best experience you guys have, they're able to take all that and actually incorporate. And Lauren, our other nurse practitioner in our other location she's mostly at, she actually trains other nurse practitioners, and what I love is opens nurse practitioners coming out of school and coming out of their education into like what is personalized medicine, what is functional medicine,
So important.
right? What is looking at root causes. So tell me this on the spot.
Okay. Uh-oh.
Alex has been with us for about a year. What would you say is probably the most profound thing that kind of is really a different experience or something that you've seen outside of the hospital or other clinic settings?
Well, coming from my background, like we talked about before, I was in ICU medicine, very acute care, a lot of chronic illness, people that had issues for a long period of time. What really strikes me coming here is that our patients actually get better. They get off of some of these medications
Right.
that they've been on.
Imagine that.
for years and years, and it's not. I always envisioned medicine, and this is not the right way to look at it. Now I truly see being under your instruction, but it was always this downward slope. Like you start at a place and it's this snowball effect that things get worse and you're trying to push the boulder up, trying to help it slow it down at least. But I noticed that our patients, they really get better. It's an upward slope to actual health, wellness, feeling better, away from chronic disease. It's just really amazing, and I wish I would have gotten into this sooner.
Yeah. Well, you got in soon enough.
Yeah, well that's true.
And you're not going anywhere.
No, but I like my background.
Yeah.
It definitely is good to know that aspect as well. But,
Yeah.
but
Well, and I think what's important, I think, in something you said that I don't think people really always appreciate it, and I want to make sure that our subscribers and people that follow us out there can really understand is that there is the potential to reverse disease and to reverse chronic conditions.
Absolutely.
Like weight issues, like diabetes, type 2 diabetes, like hypertension, like early cardiovascular disease, and besides all the hormone balancing that we do to optimize quality of life and function of life, rebuilding bone, osteoporosis, osteopenia. I could go on, but a lot of people get the concept that when they're labeled with a condition or here's some medication to take, which may be, by the way, the right thing to do at the time, but if they make a lifestyle change and take some proactive, functional approaches, some of that can be reversed.
Well, and people get this defeatist attitude too, and they're labeled with that, like you said, like they can't come out of it, but you can. You can come out of it with the right guidance and support.
Right, absolutely. So I'm passionate about educating my patients and patients and potential patients out there that follow us, but also my new kind of passion and interest is educating other practitioners, including nurse practitioners, and even potentially recruiting more to know that in their practices that they can incorporate this kind of stuff into their practice, no matter what they do, because any personalized approach to healthcare is going to have a good result. Bottom line, period. I saw cases today that I could tell you and reflect on that things were missed just by the fact that they weren't looked at in detail, and so certain things were overlooked. But well, this is really hopefully educational to you in what a nurse practitioner is, to introducing and meeting Alex and Lauren, our nurse practitioner, in the other location in Madison Heights. If you ever see them, say hello, but also be kind to them, because they work real hard and are just as passionate and dedicated to caring for you as myself and my staff. And so hopefully this gives you some insight into what a nurse practitioner is and the quality of care that we'll continue to bring you here at Longevity Health Institute. So hope this finds you well, and have a good evening.